August is National Immunizations Awareness Month. Now more than ever, it's critical to ensure that routine vaccinations is maintained during the COVID-19 pandemic in order to protect individuals and communities from vaccine-preventable diseases and outbreaks. Coming up on Polk Place, we'll talk with the Florida Department of Health in Polk County. Stick around. Welcome to Polk Place. I'm your host, Brian Lacey, and joining me in studio is Nicole Riley from the Florida Department of Health in Polk County. She is a public information officer. Wow, that's wordy.
Yeah, it is. Quite the title.
Yeah. So we're here to talk immunizations. August, National Immunization Month. And, well, considering what we're going through, let's just make all 12 months National Immunization Month. Right. What are some of the things that you want the folks to know about National Immunization Month?
Sure. Right now, as you mentioned, now more than ever, we are in a very unique time where this year we've kind of gone into 2020 with things that none of us in the world have anticipated. So prioritizing health right now is so crucial and so important. So we really wanted to highlight National Immunization Month because it's a time to reinforce the importance of immunizations for any type of disease. It's important that having those immunizations will keep us the healthiest that we can so that we can then in turn fight whatever else is out there. And immunizations, there's a variety of different immunizations for all individuals. Maternal health is a big one. For our pregnant mamas and our babies, immunizations are crucial to assuring that they have the best health possible, along with passing that on through to their babies, while they're pregnant and carrying their child. Adult immunizations are also crucial. Things like the shingles vaccine, the flu vaccine. We're in August now. We're going to be creeping into our traditional flu season on top of COVID. Yeah. And as you know, their symptoms are very similar. So flu vaccine is something that's going to be coming up that will be available. That's crucial. Along with shingles and a variety of others for adult and pneumonia for adult population. But then kids are also important too. From the time a baby is born and they first go to their doctor's visits, they have a series of routine recommended vaccines up till school age through a variety of sequenced time frames. So it's just important to bring awareness to the importance of those and to keeping individuals as healthy as possible so that they can combat any other disease that is lingering out there. Because COVID obviously has taken over, but there are other diseases still out there. And we need to assure that we are remaining the healthiest as possible to fight off all the germs.
And one of the things that we want the folks to know is with school around the corner, the school vaccinations, that's going to have a new look. Let's talk about that.
Absolutely, and thank you for that opportunity. So school vaccines, we offer at the health department back to school vaccines every year. We usually do some kind of back to school roundup where parents and families can come and bring their kids. We oftentimes have lines out the door for people coming in to assure that their children have the appropriate vaccines before they can enter school, the required vaccines. And this year is going to look different, as does everything else for 2020. Our process will be different. So it is important for anybody who is coming to the health department to get their back to school vaccines. We are offering them and we have them available, but it is crucial that they make an appointment. If they do not have an appointment, there is no guarantee that they will get those immunizations that day. We want to serve as many as frequently as we can and as often as we can. So in years past, we've done a couple of days, for a week or so where we've just brought everybody in. It's going to look differently now. We are going to have those immunizations made by appointment, and we will schedule those in up to August 21st. We will have those available. They're running those now So you can call, or parents can call and make an appointment with our call center. That number is 863-519-7910, and they can call and make that appointment and share what grade their child's going into, and we can be prepared for what immunizations that they'll need for school entry. Those appointments are available Monday through Friday, 8 a.m. to 4 p.m. But they can call, come in. When they come for their appointment, they'll want to wear a mask, and we're practicing social distancing and assuring that cleaning procedures are taking place, social distancing measures are being taken place, so they can come in with a mask. They will want to bring with them an ID. They will also want to bring with them any type of guardian paperwork. Say, they're the guardian for their grandchildren or niece or nephew. If they are not the parent of the child, they will want to be sure that they have that guardian paperwork with them. If they have insurance or an insurance card, they can bring that with them as well. And any type of paperwork, say they live out of state and they're coming and moving to Florida, and they're going to put their kids into school for the first time this year. If they are from out of state and they have those out of state shot records, they will want to bring those with them as well, so that we can be sure that we can see what they've had previously and enter it into our system and be sure that they're getting all of the appropriate vaccines.
One of the hardest people to try and get a hold of, well, I'm just going to say your office in general, public information officers for Florida Department of Health in Polk County. Even before the COVID-19 started, you guys were always on the run, but now talk a little bit about what the COVID-19 look has done to you guys and keeps you guys on the run.
We have been very active. As you know, with COVID-19, we are assuring the health of the public. So we are heading up the contact tracing and investigations for every single COVID-19 case in the county. So our dynamic has shifted a bit to where we are focused on that contact tracing and investigation efforts, along with being sure that our numbers are kept low. So internally in our clinics, we are doing the same things that we are asking businesses, schools, other entities in the public to do. We are assuring that we are having proper cleaning measures. We're wearing masks in the workplace and assuring that social distancing is taking place. We have hand sanitizer stations all over, off of every single elevator. We have, in a lot of our buildings, we have general public coming in and out, and so we've put hand sanitizing stations all over, and are wiping down surfaces and keeping surfaces cleaned. And as we mentioned with the back to school schedule, we're looking at how our clinical services are operating and having to shift and adjust a bit according to that, so that we can assure the safety of our own patients and our own staff, but then continue the services that are so crucial to the community.
I had a Dr. Jackson moment the other night watching the Cubs and Milwaukee playing. Guy gets a hit for Milwaukee, rounds first, comes back around, and Rizzo, the first baseman for the Cubs, pulls out the hand sanitizer from his pocket and pours it into the guy that got the hit, and he cleans his hands, and the game goes on. And I was like, wow, Dr. Jackson would be so proud.
Yes, that's awesome. And my kids are in school too, are in daycare, and so before they go into the building, every single time they have a hand washing station. And so my 3-year-old, she just turned 3, is always washing her hands, making bubbles, wash away the bubbles. And so as we're nearing school, and as our kids are going into school in a couple weeks now, practice that with the kids too. Those hand sanitizing options, or going through and talking to them about it's important to scrub for 20 seconds, singing happy birthday twice, or make bubbles. Okay, make sure you get all the bubbles and rinse away the bubbles to wash away the germs.
Well, we got just a little bit of time left. Talk about the importance of August being Immunization Month and everything that folks need to do. Kind of recap it for me.
Yeah, absolutely. So it's important that people really take this seriously and do what they can to prioritize their health. I mean, these are unprecedented times, and so getting in those immunizations, call their doctor or the primary care provider to be sure they are up to date with vaccines. And if they're not, schedule an appointment to go in. as always, being sure to practice health measures like washing our hands 20 seconds or more, hand sanitizer, wearing a mask when out in public, and social distancing, and just try to remain healthy as possible.
Well, Nicole, thanks for coming in. Thanks for giving us all the information, and we'll see you guys again next month.
Yeah, sounds good. Thanks for having me.
August is National Immunizations Awareness Month. Now more than ever, it's critical to ensure that routine vaccination is maintained during the COVID-19 pandemic in order to protect individuals and communities from vaccine-preventable diseases and outbreaks. Routine vaccinations prevent illnesses that lead to additional medical visits, hospitalizations, and further strain on the healthcare system. One of the best ways the Florida Department of Health in Polk County is recognizing this is encouraging families to prioritize back-to-school vaccines before the start of school. The Health Department will be offering back-to-school immunizations by appointment to ensure families and children can get the vaccines that they need. If you need more information, you can give the Florida Department of Health in Polk County a call at 863-519-7910 for an appointment, or you can look them up on the web at www.floridahealth.gov.